My name is Luciana Berger. I'm a big supporter of the Big Tent, and I join you now as a former Member of Parliament, where I focused over the course of the last 7 years in all matters to do with health. I served as the Shadow Minister for Public Health and the first ever Shadow Cabinet Member for Mental Health, and then sat on the Health and Social Care Select Committee. And today I'm involved in a number of different mental health organisations. I advise the Money and Mental Health Policy Institute, and I'm Vice President of the British Association of Counsellors and Psychotherapists. And by day, I work for Edelman in advocacy and campaigning and public affairs. If I now turn to the very important issues that we're discussing this evening, and we are having a conversation about something that really matters. The health of our nation is certainly something that we're seeing more attention turned to, and we've got some way to go before we see real action in this area. We don't yet know the full extent to which lockdown and COVID have impacted on all of our mental health. And it's fair to say before March, before COVID hit us, we were making quite a bit of progress in our country when it came to mental health. First and foremost in the national conversation on this topic. That means tonight, we've got so many people that are joining this call, openly exploring these issues. That wouldn't have been the same if we'd come together 10 years ago. And it may not be enough, but we've certainly seen an increase in the investment going into our mental health services. Certainly at a different moment, we can have a wider debate about the social determinants of mental health and the role of the whole ecology of our communities and public services in how we should as a country keep people both physically and mentally well. But we're going to save that particular debate for another time. The focus of our conversation this evening is on Britain's mental health epidemic, which we know has been exacerbated during the lockdown for lots of different reasons. It's fair to say, at the start of the pandemic, we were rightly as a country focusing on how we preserve our physical health. How do we preserve life? How do we keep as many people well and contend with people who are very, very seriously ill, and the very high levels of people, the devastation that have been faced by people that have very sadly gone on to lose their lives. But we know that's also come at a cost, and it's come at the expense of all of our mental health because of the repercussions of living in lockdown. Too many of us have been disconnected from friends and from family. Sadly, too many of us have lost loved ones and not been able to grieve in the way in which we are normally accustomed. We know it's been particularly challenging for young people who've been disconnected from their friends and not able to go to school. Parents of young children who haven't had access to childcare, those young children not able to socialise in the same way. We've had to experience change working practices. And some people haven't even been able to continue working because they've been impacted by whether it's furlough or sadly losing their jobs. There's been gross economic impacts, which again, we know disproportionately impacts on the nation's mental health. I was on a call earlier with the Maternal Mental Health Alliance. There's been a very specific challenge for expectant and new mums having to go through the early stages of childbirth without their partners at their side and not having the traditional support structure around them as they care for their babies in those early weeks. We know people working on the front line who are facing health challenges themselves, really facing extreme pressurised situations, people working on the front line in the NHS, in social care, people working on the front line in our shops and in our delivery networks and ensuring that we've got access to food. We've also tragically seen increased incidences of domestic abuse. The combination of all these things means that any sort of mental health crisis we had as a country before is now magnified. And it's only now that organisations, charities, research groups are looking to quantify what the impact has been and in fact what the impact will be. And we're not going to find out for a number of months and possibly years what the true impact of this period is going to be on our nation.